I do want to just share a little bit about my background for those of you who don't know me. When I'm not here at the legislature, I serve as CEO at Tammy Lynn Center for Developmental Disabilities. And I know a lot in this community are familiar with that organization, but we provide a wide array of services there, including community-based ICF homes, innovations waiver homes, respite, community living supports, ABA, and a lot of other things. Somebody, as I was telling them what we did, they said it would be easier for you to tell us what you don't do. And I said, that's probably true. I've been working in this field on and off for about the last 12 years. I started at TLC 12 years ago in a different role, took a little break to work at the intersection of social services and higher education, which had some IDD focus as well, and then came back as CEO at the end of 2020. And so I'm bringing that knowledge and that experience of the provider, kind of the on-the-ground provider level, to the North Carolina General Assembly. What the North Carolina General Assembly really has primary responsibility for when it comes to the IDD community is funding. We do set the budget for the state of North Carolina, and included in that budget are things around Medicaid funding, our innovations waiver slots, rate increases, pay for workers. All of that is included in the North Carolina General Assembly's purview as it goes to funding IDD services. And that's all of the services that fall kind of under Medicaid. So allocating those dollars, of course, that flows through our managed care organizations and now the PHPs with standard plan, and then to the families and the providers. We also provide direction to the Department of Health and Human Services. So, of course, DHHS, they do set the rules, they make the plans when it comes to serving our community. But we, the General Assembly, can provide direction to DHHS, and we also provide oversight to DHHS. There's a committee, a joint committee of the House and Senate on Health and Human Services that will meet and provide oversight to DHHS and on other issues related to health and human services. In addition to those kind of formal mechanisms that we have in the General Assembly to provide services and supports in the IDD community, there are also a number of constituent services that we perform for constituents. So, for example, if you are having an issue, finding services, getting services, maybe you've been approved for innovations waiver, but you are not able to find services, we can field those calls and try to help you track down what's going on and figure out where something might be stuck. So, for example, I just helped a constituent, actually wasn't one of my constituents, I was helping a colleague who had a daughter, or had a constituent who lived in another county who needed kind of an emergency bed per se. Their primary caregiver, their mother, she was going into surgery and had been trying to work through the system to get a bed for several months for their daughter, and they called their legislative representatives to figure out how to make that happen. I got asked to support, to see if I knew of any resources, and we were able to get that individual a placement within 24 hours so that they could receive the care that they needed while mom got surgery. So we help on an array of issues. We can't make services be where there are none, but we can certainly help navigate to services through our connections with DHHS, through the connections we have with the managed care organizations, and also take note of the issues that you're facing so that we can make better legislation when it comes to that. So that's a little bit about our formal and informal roles related to our work here at the General Assembly. I think last session was probably the friendliest General Assembly when it came to IDD services. It doesn't mean that we got everything done, but we allocated a great deal of money. I don't have the exact figure for you, but A lot of you will remember that we increased Medicaid rates so that individuals working under ICF and home and community-based services could get paid higher wages. It did bring ICF workers up to $15 an hour minimum. It brought home and community-based service workers up, not to $15 minimum. The rate increase was not quite enough. And trust me, the General Assembly has heard about that. But please keep those stories coming. We also gave some one-time bonus money for our workers under other subsets of Medicaid to help alleviate some of the worker shortages that we have. Continuing to work on that DSP workforce crisis is a priority for members in the General Assembly. And I've talked with both members in the House and Senate, both Republicans and Democrats, who are really understanding the importance of this issue. And that plays so tightly in with the other issue that we are keenly aware of, which is the innovations waiver waitlist. We have got to get people off the innovations waiver waitlist, and we know that there are, as you know, 16,000 folks on the wait list. And part of the challenge is when you remove folks from the wait list, you put that funding towards the wait list, towards those individuals. Sometimes because there aren't workers, those individuals still aren't receiving services. And so we have to work on both of those issues at the same time. And there's been a lot of work coming out of the Council for Developmental Disabilities, coming out of DRNC, coming out of the providers to really work particularly on this DSP workforce shortage. And so I would say those are our two biggest priorities when it comes to this next biennium. And there's already been a lot of conversation about how we tackle these issues and what kind of funding we need to put towards the effort to solve the DSP workforce shortage and get people off the innovations waiver waitlist. It is going to be an iterative process. We're not going to solve it all this year, but there will be a plan in place, and the department has been working on that as well. For those of you who may be new to communicating with your legislators, we're people just like all of you. And a lot of us have jobs and kids. And so, it's no different talking to us than it is to anybody else, but we need to hear from you. Your legislator needs to hear your story, how you've been impacted by either services that you have received or services that you need, or workers who have quit on you to take jobs where they're making more money at Walmart or Starbucks or Target. Or your workforce stories related to you or your loved one who has a disability, who wants to work and isn't able to find that work. We need to hear those stories. And I will tell you the number one thing that I have seen help change the minds of legislators are those individual personal stories. Data is great. We love data. We love information, but those personal stories are really what can take somebody from a no to a yes on these issues. I do think, like I said, there's a lot of bipartisan support. I think you're going to see another General Assembly that's very favorable to the IDD community, and I'm excited about that. But I really encourage you to reach out to your legislators and tell your personal story, and then tell them how they can help. Invite them to see. To meet your loved ones, to, if you're getting services through a provider agency, to come to that provider so that they can learn and see with their own eyes the good work that we know is happening in communities all across North Carolina, but how much more work there is to be done.